as any other whole milk.
Hello there and welcome to yet another episode of Health and Wellness Show. My name is Chabet Birir and today we have an interesting episode for you. Cancer. We are talking about cancer, how to prevent it, how it is diagnosed, and how you can treat it and manage it. Cancer is one of the leading causes of death in the country, and specifically in women. Cervical cancer is the leading one, followed by breast cancer. And Brookside has partnered with the Nairobi West Hospital together with the Needy Cancer Health Initiative to bring cancer awareness closer to the community. We'll talk about all that, but first, take a look at this feature.
Irene Wanjiru was diagnosed with bone cancer in 2022. She says that since then, the journey has not been easy, but with the right support from her family and organizations like Brookside and the Needy Cancer Health Initiative, Irene says the burden has been lifted.
Vile nilipatana na watu kama mimi, wamekuwa na cancer for 10 years, wengine wako na for 20 years, na ako tu na ako sawa. When I get to those groups, hizo group ndizo zimenipatia moral. Tunaongea kila mtu jani yake. Mimi nimepitia, unakuta yako hakuna kitu. Kuna mwingine amekuwa akawezi kula vizuri, anakula na tube.
Juu sina mahali popote nafanya, wananiletea wananitafutia tuseme kitu ya kukula. Yani wanani take care of. Juu sina mahali pengine. Alafu hii cancer ya mapua tuliambiwa na daktari ama daktari anakuona usiendanishe na jua. Sasa lazima uwepe jua juu usiende kukua umetofika. Lazima ujifiche jua. So mimi nategemea kwa watu kama hao na cancer patients groups. That's why na survive.
Cancer continues to claim thousands of lives each year in Kenya, many of them due to late diagnosis. But a unique partnership is bringing hope, education, and free screening to communities in need. Brookside Dairy, the Nairobi West Hospital, and the Needy Cancer Health Initiative have joined forces to fight breast and cervical cancer through early detection.
Part of prevention of some of these diseases really just comes from nutrition and what people are eating. So that is the reason why we are here. And then another reason why we are here is because we work with healthcare professionals so that they can help us to innovate some of these products. We don't do it on our own. So we are working with them for this journey. So that is the reason why we are here today.
In a powerful health drive held at Lungalunga, hundreds of women turned up, not just for information, but for life-saving action. Through free breast and cervical cancer screening, the partnership aimed to demystify cancer and promote early detection.
That cancer is just like any other disease. Unaweza gojeka homa na uende. Unaweza gojeka cancer na ukae 10 years. So, enda utilitiwa, go for screening. Kitu yote inaweza wa encourage sana. Waitikie kwenda for screening. Because ikijulikana mapema, ndio tu utaweza tilitiwa kwa haraka na haitakuwa na hiyo matibabu kali sana.
Cervical cancer is the leading cause of cancer-related deaths among Kenyan women, followed closely by breast cancer. But according to the Ministry of Health, early detection can reduce fatalities by up to 80%.
Kitu nimetamani sana kujua hali yangu. Nilikuja ni screeniwe ni ya cervical cancer na breast because nimekuwa na issue ya breast, so nimetamani sana kujua hali yangu. So that's why nikatamani nifike hapa na nimefika usiku ya leo nikapata matibabu. At least nimejua hali yangu kuanzia leo, na ningependa kuambia watu hii kitu ni mzuri, kujua health yako, kujua status yako. Ni vizuri ujijue, hata kama ni kitu utapata, it's better than ukae kwa nyumba. Umejua ni kitu kijulikana mapema, inatibika na mtu asiogope.
In a country where stigma, cost and misinformation still hinder access to timely cancer care, this partnership is restoring dignity, spreading awareness and saving lives.
And today I'm at the Nairobi West Hospital. We want to see and experience the process of a cancer screening, the diagnosis, the treatment, and what you need to do after a cancer diagnosis. Come with me. Hi. How are you?
Yeah, good.
I'm Chebet.
Nice to meet you.
Asante.
I am Sister Leah. How can I assist you today?
Yeah, so I'm here to see Dr. Afrin
Yes.
for cancer screening. I want to do breast cancer screening and cervical cancer
Do you
screening.
have an appointment with her?
Yes, I do.
You have an appointment?
Yes, yes.
Okay, so the first thing we're going to do, I'm going to take your vitals.
Mm-hmm.
You said your name is who?
Chebet.
Your name is Chebet.
Chebet Birir.
Chebet Bihira.
Yes.
Fine, I want to take your pressure.
Okay.
That's good. Okay. I want you to
All right.
relax.
So,
Relax. Just sit back and relax.
okay.
Yep.
So they're just taking my vitals.
Before she sees the doctor, we take the vitals
Mm-hmm.
and then now we send to the doctor
Okay.
so she can see how your vitals are.
How my pressure is.
Yeah.
I need to relax so that it doesn't
relax.
shoot.
And first, you're not supposed to talk. So
Okay.
yeah. Meanwhile, I'll take your temperature. Take it from there. 36.6.
Is that normal? Okay. So my blood pressure is normal.
Yeah, the blood pressure is normal, the pulse rate is normal, and then the
Oxygen levels.
94.
What's the normal range?
Yeah, it's the normal
It's in the
range.
normal range.
Yes.
Okay.
Okay. And then now I want to take your weight.
Okay.
So you come here, you stand here, so I can measure your weight.
Okay. Okay.
The other way.
Oh, the other way around. Sorry.
Your weight is at 77.2.
0.2. I'm above my BMI. Good afternoon,
We have
Leah.
a patient who's going to see you. She's going to bed. May I ask her to come in?
Please kindly ask her to come in.
Janet?
Hello, Daktari.
Hi, Chebet, how are you?
I'm fine. How are you?
I'm good. Please take a seat.
Thank you.
My name is Dr. Freen, and tell me, Chebet, what brings you in here today?
I would like to screen myself, or I would like you to screen me,
Okay,
breast and cervical cancer.
great. So
Yes.
before we go on to the screening, I'd really like to just ask you, what do you know about cervical cancer?
What I know about cervical cancer is that it is a leading cause of death among women in Kenya, specifically, Africa as well. And I also know that it is important to screen early to prevent, the adverse effects of screening later, which could be irreversible.
Great. So
Is
I'm
that correct?
You're correct. Yes, partially correct. But
Yeah.
that's okay. So I'm going to briefly explain to you what cervical cancer itself is.
Okay.
And what the screening entails and why we need to get screened regularly, all right? So I'll just draw some diagrams so at least you're able to appreciate what I'm talking about. So basically, cervical cancer is a cancer that affects women. And mainly what we see is women around the ages of 45 to 50. That's our main affected group. However, we do have young women and even elderly women who get affected.
Okay.
So this is basically, it cuts across, and that is why we need to screen. But in Kenya currently, we're seeing like 9 women die of this cancer every day.
That's a big number.
That's definitely a big number. And we're
Yes.
losing our mothers, sisters, and daughters to this cancer, yet it is almost 100% preventable and, of course, treatable if picked early. So now that's where cervical cancer screening comes in. So screening is what we do for cervical cancer screening is we're going to do there are a couple of tests that we can do, and these tests are the pap smear, okay, and the HPV DNA test and visual inspection using acetic acid. So cervix basically is just the neck of your uterus. So I'll draw for you. This is basically your uterus, and this is the neck of your uterus, what we call as the cervix.
Okay.
So when the cancer develops, it develops in the cells that are in the cervix. So when we are able to screen, when we screen, basically we're picking, and the transition period from the time you develop precancerous conditions to the time you actually develop cancer can vary anywhere between 5 to 10 years. So you see, we're able to pick this before it forms cancer.
Okay.
Yeah.
I have a question.
Yes.
How do I know that I could be having cervical cancer? Are there signs and symptoms?
So yes, there are signs and symptoms, and key or pertinent signs that you or we need to watch out basically for is bleeding.
Bleeding.
Basically, this bleeding, when it comes, it's a little, what can I say, the cancer is a little advanced. Basically, the early cervical cancer is asymptomatic. You'll not really have a lot of, when I say asymptomatic, there are really not many symptoms.
Yeah.
However, when you start experiencing bleeding, that means the cancer is there possibly, you know.
Okay.
And this bleeding can be bleeding after intercourse. That is a very important thing that we need to note, you know. It can come because it's called what we call as contact bleeding.
Okay.
Or, yes.
And how will I know that the bleeding is not from cancer? It's from my period. How do I differentiate that this could be cervical cancer or just my period?
So that's why we need to now come in and get checked. Any bleeding that is abnormal not during your menses, we should be worried and we should concern. Even intermenstrual bleeding needs to get checked. You know, bleeding that happens between your menses, or any women who are old and postmenopausal. So postmenopausal women should not have any bleeding whatsoever. So any of these women, if you're having bleeding that is abnormal outside your period, needs to get investigated. Even during your periods, if you're noticing very heavy menstrual bleeding or bleeding that is, very prolonged, meaning it's instead of your routine, initially maybe you're having periods for say 3 to 7 days, and now you're seeing that bleeding for almost 10 to 12 days or 2 weeks. That is not normal. So that needs to be investigated, and this would be very, very important that you go to your healthcare provider. It's always important that you go and get tested, so at least we can get, if you have an abnormality, it can be picked up early. So for the cervical cancer, basically, why we need to screen it, the transmission, there's a virus called the HPV virus.
Yes.
That's what causes, it's the main causative agent of cervical cancer. So once we get this virus infected, any woman gets this virus infected and gets infected with this virus, like almost 100% of women who are sexually active will get this virus at a point or another in their lives. However, majority, almost 70 to 80% of the women are able to clear this infection. So what the tests basically entail is we just take a smear of your cervix, and the cells are then smeared on a slide, and they're then sent for the pathology team to have a look. So in case there's any abnormality that is detected, that will come back, and then we treat accordingly depending on what. Now, this is regarding pap smears. The HPV test is something we just do a quick smear of your cervix or in your vagina, and then we send a smear. When it comes back positive, this is a test that is, it's highly sensitive.
Okay.
So once you get this test done, it's negative at least for the next 5 years. You don't have to get it done again.
Awesome.
So
I hope
that's
it turns
very
negative.
cost effective.
I hope it turns negative.
Yes. So
Yeah.
that is this. So we can go ahead and do this. I'll ask my nurse to position you.
Okay.
It's not painful. It's a very simple test. It's just like, how we do routine screening. Yeah.
Okay.
So we're going to do this, and you'll just experience a little discomfort, not necessarily pain. Okay? Great. Are you ready?
I'm ready.
All right.
I'm ready.
Shabbat, are you ready? Can I come in?
Yes, you can, Doc.
All right, great. How are you feeling?
I'm tensed.
I need you to relax, all right?
Okay.
So what we're going to do is we're going to take a bit of some samples from your cervix. I'll insert a speculum, meaning an instrument, and that will open your cervix, and then I'll take some cells from there. It's going to be a little bit uncomfortable, but not necessarily painful.
All right.
All right?
All right.
So
I'm
I
ready.
need you to relax, and then I need you to screw down a little bit, and we're going to do that.
Okay.
Right, great.
So,
All right, relax. So Chabat, I'm going to insert a speculum. I have an instrument which I showed you earlier on.
Okay.
It's called a speculum. I'm going to insert it and open up your vagina. This is going to be a little bit uncomfortable, but it's going to help me see your cervix. Is that okay?
That's okay.
All right. So I'd like you to take a deep breath and just relax. I want you to relax. All right?
Okay.
All right. We're almost there. Great. Thank you. Just relax. Take the deep breath. There. Okay. Great. So I've taken this mirror. Okay. So we're basically done. We're done.
Okay.
You okay?
I'm okay.
Okay,
It was a
great.
bit uncomfortable, but
Right, I'm here for my results. They're already out, but they're private. So we are going to assume both sides, positive results and negative results. Dr. Afin, assuming that my results are positive, what do I need to do?
Okay, great. So if your results are positive now, that meaning if we do detect something on your pap smear, there are multiple things we can detect. So something known as pre-malignant conditions, meaning precancerous. You haven't developed cancer, but if these conditions are not treated, then you can go ahead and develop cancer. So it's mandatory we see what kind of condition it is and then offer the appropriate exam.
All right.
So if it's a pre-malignant condition, then the next step, what we'll do is a colposcopy, after we've done an HPV DNA test. So the colposcopy is basically we're going to look at your cervix at a close view, magnified cells. If there's abnormal cells, we'll then take biopsies of those cells. And these biopsies then will take another 7 to 10 days for the results to come back.
Okay.
And once the results will come back, if it still remains as a pre-malignant lesion, meaning pre-cancerous, it means your cancer, there's no cancer, but there are cells that are quite abnormal, and if these cells this is not treated or this condition is not treated, that they can eventually become cancer. Once we diagnose the cancer, now depending on the stage, the treatment will depend on what stage it is. If it's an early cancer where we can offer surgical treatment, then we'll go ahead and operate you. And surgery can be hysterectomy with removal of your pelvic nodes and ovaries and fallopian tubes as well. If it's an advanced stage where we can't operate, then the next treatment is chemoradiation, meaning we administer chemo alongside radiotherapy so that we can, with an intent to treat your cancer. So they go hand in hand.
Daktari, what's the difference between chemotherapy and radiotherapy?
So basically, radiotherapy is a localized treatment. It doesn't go to the full of your body. Whatever area we are targeting, we are going to give you radiation in that. It's just X-rays, but a very high dose of those radiation. Okay. So that kills the abnormal or the cancer cells. While chemotherapy is basically a drug we give through through the bloodstream. So we give it through your IV lines. We put a cannula and then we give it. So it targets basically the whole of your body. Okay. So if you have cancer that is quite advanced, then that's what we do, so that it can take care of the abnormal cells. Okay. It's more of a systemic treatment, not like a localized treatment.
All right.
Yeah.
Would you take me through it in the radiotherapy room?
Definitely. Let's go. We can show you more and then you can learn more about radiotherapy.
Okay, perfect. Come with us. So, Daktari, what really happens in this radiotherapy room?
Okay, great. So this is where you're going to get most of your treatment. This is a linear accelerator, LINAC. So you'll be positioned here and before
with my head here.
With your head here.
Okay.
And like I said, it's a localized treatment which delivers radiation to a specific part. So in your case, it will be the pelvis. The contouring will be done, and all this treatment will be delivered by the radiation oncologist, whom you are going to meet shortly. Okay. Once you've done that, then your treatments will be given every day for the next 25 or 28 days. After you complete this treatment is going to be externally. So in order for us to give you the maximum dose, once you've got the external treatment, you will need also an internal radiotherapy, which we call as brachytherapy. So that is done in a different room. Here, you will come for the next, 5 weeks, 5 to 6 weeks. But your treatments will usually last around 5 to 5 to 10 minutes every day.
And what are the effects of me lying here and going through this machine? Any negative effects?
So with radiotherapy, just like any other treatment, yes, there will be side effects, which we'll go through each of these side effects individually, but it's localized side effects. And currently what the kind of radiotherapy we're delivering is more precise. So here, meaning when I say more precise, the spillage of radiation to the surrounding structures is less.
Okay.
And that means you will experience less side effects as compared to before, when we used to not have we had the 2D techniques, or we were using the cobalt machine, which would result in drastic complications and side effects. So some of the side effects, like it's radiation, so you are likely to get radiation-induced burns. Now, this is again graded. They can be minimal, they can be severe. The grading will vary.
Okay.
Every patient responds differently. The side effects also are different. All the structures that are here, meaning, yes, your uterus is there, but in front of your uterus, you have your urinary bladder, meaning your urine pouch. And behind you have your rectum, where you poop from. So when the radiation is given, also these structures will be radiated. So you can experience some constipation or diarrhea, sometimes excessive urination, what we call as frequency. This can be burning. There can be some cells in your urine. The cells from your bladder and your rectum also peel off, So you can experience hematuria, bleeding in your urine or in your rectum. So these are some of the common symptoms that you're likely to experience. Other very rare symptoms can be some sort of necrosis, or because to your hip bone, what we call as avascular necrosis of the femur, because the radiation can also, but that's very rare. But yes, it's potential side effects. Very rarely do women get that.
Okay, but we also have the positive side of radiotherapy, which is focused treatment. You said the difference is chemo is general and radio is focused. So in this case, only the cervix and the area around the cervix is where the treatment happens?
Yes.
Okay.
So that is what our target is. Yes.
There you have it. So next we'll talk about now the management of cancer, right, Daktari? Yeah, how you can manage it, how what you need to eat, what you need to avoid. Please stay with us.
You're watching Health and Wellness, brought to you by Brookside.
With lactose-free milk, you're still able to use this milk in your normal preparation of food, whether you want to add it while cooking or you want to use it in your favorite cup of tea, chocolate, or coffee. You can still use lactose-free. It has the same great taste as any other whole milk.
Welcome back. If you've just tuned in, my name is Chebet Birir, and this is the Health and Wellness Show. Today we are talking about cancer, specifically the cancers that affect women, from breast cancer to cervical cancer. And we're just from our radiotherapy room, where Dr. Afin took us through the process of radiotherapy when you've been diagnosed with cancer. And now we want to move into treatment options, management options. And on set, apart from Dr. Afin, of course, I have Nana Kilemi, who is the founder of the Needy Cancer Health Initiative, and she'll tell us why she decided to found that organization. Karibu sana Nana on set.
Thank you so much.
And I also want you to tell us your story, because cancer is not a death sentence. That's what we want you to understand. If you've been diagnosed with cancer, it's not the end of life. All right, and Brookside Plus has partnered with Nana's organization, the Needy Cancer Health Initiative, together with the Nairobi West Hospital, to bring cancer awareness to the communities, and of course to you, wherever you're watching this from. Brookside Plus, Live Life Plus. And of course, on the table, we have some yogurts. My favorite is vanilla. What's your favorite, Nana?
Natural.
Natural. And Dr.
Mine do natural.
You do natural.
Yeah.
Me just depend if to plain, but okay. Yeah, this is my favorite vanilla probiotic yogurt. And we'll talk about how this helps cancer patients. to, help with the digestion after radiotherapy and everything. Daktari will explain to us better, and of course Nana, who has the experience of all this. Karibuni sana to the show. And I want us to dive right into your experience, Nana. In 2020, you had some signs and symptoms which you said you ignored. And in 2022 is when you were diagnosed. How was it? How did you feel when you got that diagnosis?
Thank you so much, Beth. My name is Nana Kilemi. I'm a breast cancer survivor, 3 years in remission now, and founder Needy Cancer Health Initiative. And I also work with the Nairobi West Hospital at the marketing department. I was diagnosed with breast cancer in 2022 August. But to be sincere, I had that lump for 2 years.
You had the lump for 2 years?
Yes, I was quiet, and because I was very, very scared. Because I have seen people with cancer, people die of cancer, and the thought of me thinking that breasts could have had cancer was very scary. But then, with cancer, the body is never quiet. So every day, my body got worse, and the worst came in 2022, actually 1st of August, when my breast tethered. They called it tethering. Yeah. And of course, now I have to go to hospital because the pain was unbearable. And the worst came to the worst. I was diagnosed with stage 3 breast cancer.
Okay.
But I've been treated here in Kenya for 1 year, actually. My treatment took exactly 1 year. 1st of August 2022, and then I was declared cancer-free.
That's amazing.
3rd of August 2023, exactly 1 year in Kenya by our doctors and then others. So, the thing is, we have good doctors in Kenya. Cancer is not a death sentence. It is not witchcraft. It is a disease like any other.
It is not a death sentence. It is not witchcraft. We'll come back to you,
yes,
Nana. But Daktari, please tell us, what are the most common cancers that affect women?
In Kenya currently, the topmost cancers, or can I say the topmost cancers, are breast and cervix that affect women, with breast being the #1 cancer, followed by cervix. However, we have a significant number of women that is cervical cancer is the #1 cause of death. In gyne cancers, rather, in women's cancers, the top 3 cancers that affect women in Kenya include cervical cancer, ovarian cancer, and endometrial cancer. Endometrium is just the womb, basically. So womb cancer, can I put it in simple terms? So the unfortunate part is we lose almost 9 women every day to cervical cancer.
That's a huge number.
That's a significantly huge number. And the sad thing is, this is a cancer that is completely preventable. It's just that lack of knowledge, awareness, and women are not able to reach or access resources at an early stage that delays the prevention or that delays us to pick these cancers late, that then they come at a stage there's not much we can do. So that's, I think, one of the most challenging things that we experience, particularly with women and how they present.
And we'll talk about how to prevent it. But first, Nana says there's some symptoms she ignored. She had a lump.
Yeah.
What are the other signs that you can tell? Maybe I have breast cancer, I need to get checked. What are some of the symptoms?
So some of the symptoms, if you're looking for breast cancer, like I'd always advise every woman to self-examine themselves, It's a routine examination. You just, even when you're taking a shower, you examine for any lumps or anything abnormal. Sometimes you can have discharge. That can be your first symptom, or a lump, It's always good to go and see your physician. Other advanced symptoms, there can be some skin changes over your breast, and that would point that this is not normal, that this is abnormal. Pain as well. Recently, I myself saw a woman who came, I think she incidentally picked up the cancer. She actually came for her pap smear, and she said that I'd been carrying something very heavy, and I'd walked like for almost an hour. My shoulder is paining, and along with the shoulder, I'm having some pains on my chest. So I said, let me take a look at your chest. And there it was, a huge lump, She's like, no, the swelling is because I've carried very heavy weight, So this goes a long way in saying, because you see, you have these symptoms, you have these lumps, yet you don't know that that is not normal.
Okay.
So we need to break that stigma. We need to make women aware of their bodies, that this is, if you're bleeding, it's not normal to have abnormal bleeding that is not during your menses. Or if you're having intercourse after your intercourse, if you're seeing bleeding, that is not normal. Or bleeding between your menses, it's not normal. You need to seek advice.
Thank you, Daktari. Nana, when you realized you had the lump and you went to hospital, what were the things that were going through your mind? Because there's that mental anguish that comes with the diagnosis of cancer. How did you feel about it the first time you were diagnosed?
Of course, I was really taken aback. Cancer diagnosis is not a very easy diagnosis. My world was shattered, for sure. Especially because I'm a single parent. And I was thinking about the financial constraint and the support. But I thank God, the support system he put through for me, my siblings, my friends, they really, really played a role in my healing. So the support system made it very, very easy for me to heal very, very quickly.
Okay.
Yes.
That's amazing to know.
Oh, yes.
And of course, that must have led you to found the Needy Cancer Health Initiative.
Yes.
We'll talk about that. But Daktari, tell us, what are some of the myths and misconceptions when somebody is diagnosed with cancer? The first thing that would come to my mind is death. I'm going to die soon. But cancer is not a death sentence. Nana is here. What other myths and misconceptions are there?
I think we encountered this very commonly, and this is what, like I mentioned earlier, this is one of our biggest challenges, the late presentations. And why this happens is because there's a lot of misconception and myths regarding cancer itself. I've heard a lot of women say that, when something touches, a metal touches my breast or my body, the cancer or whatever growth, it's going to grow at an abnormal rate, and so I don't want to go. And I've had people sit in my office and deny to undergo a procedure that could be life-saving,
What are some of those procedures?
For instance, when we have cervical cancer, or we diagnose a woman with endometrial, that is womb cancer, or ovarian cancer. So most of our surgical treatment would entail removing these cancers, which means removing the uterus. Again, I'll come to that later on, and what that basically translates to our women, what goes on through their minds when we are talking about potentially removing your ovaries or your uterus. But yes, these are some of the surgeries we do. And so, of course, women will go on to say, once you touch this, it's going to grow. And so they don't come until it's very late. A lot of our women would rather go to, seek herbal treatment. And this is very common, and this would delay the treatment substantially. So by the time they come, again, that option of the surgical treatment is off. Another main, or major misconception is the personal thing. What will my neighbors say, or what will my partners say? Particularly when I talk about gyn cancers, these are very intimate, cancers that are very intimate, if that's a term I can use. So yes, and nobody wants, when you talk about gyn cancers, they'll say, my partner will leave.
Yes.
And that is common. We recently did a study at one of the hospitals in Western Kenya, and we noted that quite a significant number of women were deserted by their partners after a diagnosis of cancer. And that brings me to another another story of a young woman who I saw immediately as soon as she was diagnosed. And this was during her pregnancy when she got diagnosed with the cancer.
Cervical cancer?
No, she had ovarian cancer.
Okay.
So when we picked up the diagnosis, this was during pregnancy. She was pregnant at that point. So it was relatively early cancer. And she would have had her prognosis or outcome would have been better if we had continued with the treatment. But unfortunately, as soon as she got that diagnosis, her partner abandoned her. And she was the main, or rather, she was entirely dependent on this partner. So she had no financial means. And this is what, again, I'll emphasize on what Nana said, financial
Finances
aspect.
is a key
Yes,
thing
exactly.
when it comes to cancer treatment.
Yes, if I can use the word financial toxicity, it's very real. And our patients experience that. And we do need to develop some navigation programs that can help our patients navigate the financial aspect of cancer treatment and cancer management. So yes, this is more main, the partner abandonment, again, witchcraft, That is one of the most, can I say, common thing, a thing that a woman would say, oh, I have been bewitched. And yes, somebody can be bleeding continuously, yet she would not come to the clinic, and you ask her that, why? I think someone has bewitched me. So these are some of the common things that we see. And then now we come to why, when you offer these treatments, again, we talk about hysterectomies. And I'm using very big words such as hysterectomy, but for the audience, I'd like to break that down. What does a hysterectomy mean? So basically, a hysterectomy is just removal of your uterus. And most of our procedures would also entail removing your ovaries and fallopian tubes, meaning when you remove the ovaries and your fallopian tubes and your uterus, basically we are inducing menopause. You are
your reproductive system is out.
Yes, your reproductive system is out. So now you can just imagine the possible questions that go on through this woman's mind, her partner's mind. It's difficult, particularly when we come to the younger women,
Okay. So I like that you've mentioned three things: financial capabilities when it comes to treating cancer, the hysterectomy bit, and of course the relationships. And I don't know about you, Nana. How was it? You said you were a single mother when you got the diagnosis. But how has it been navigating relationships after the diagnosis? I know you said you're cancer-free, but people still may think, maybe she has cancer, maybe it will be a burden to me. How has it been for you navigating relationships? And not just romantic, also socially, in terms of friends. How has it been for you?
Can you imagine up to now, this vocal now is still being, I still get a lot of stigma. People don't, most of people don't believe that cancer is 100% curable. So people ask me, as early as yesterday, someone asked me, a close friend of mine, I was like, my God, this can't be happening. They said, Nana, are you sure you completely got healed? And Chebet, really, that is very heavy on me. And so you can imagine if they are telling me that. What about those women we left in Lunga?
Yes.
The women in deep inside Meru, in Kisumu, what do they go through? It has been difficult. Up to date, it is extremely difficult for me, and I don't even want to go to say about relationships, especially with men, because they only look at me like a dying
woman.
Yes, actually, yes. Even yesterday I was telling one of them, I know you look at me and think I will die tomorrow, but it doesn't work like that. So yeah, it is very difficult. I'm telling you from a personal view, experience, yes, it is very difficult. People don't believe that I'll be there tomorrow, or even the day after tomorrow. People are like, but she has been sick of cancer, but she has been charged by cancer.
And how do you manage all that?
And nowadays, I don't really care. I laugh actually at them. I'm like, okay, you think I'm really going to die tomorrow? Watch this step. Actually, someone, a very good friend of mine. Okay, yesterday was just a bad day. She told me, so are you still dating? I said, why are you asking? She said, if you have a man who is dating you with their situation, do you mean men don't touch people who have been touched by cancer? A woman friend of mine.
A friend of yours.
And this is someone who has even a PhD, but academician, not medicine. And those things are really, really heavy.
Stigma.
A lot of stigma.
We'll talk about that. But tell us, why the needy Cancer Health Initiative?
The Nindi Cancer Health Initiative, it's a dream which was born out of pain. Because when I was in hospital, I could see actually my main concern was the women with the cervical cancers. And that is why I'm always on Dr. Afrin. She knows I'm always following her.
Yes.
Afrin, let's do this. Now when we are sitting there, I was telling her we need to go to Meru.
Yes.
Because I would see women who would come alone from very far, bleeding in a lot of pain. You know, cervical cancer does to them. And then they would come and stay in the hospital benches for 2 to 3 days with no treatment, because then NHIF was supposed to be paid for a whole year, but someone has paid for 1 month. And you're supposed to pay for 2 years so that you can assess. So that is how it was born. I told my friends, can we pick one patient, pay for them so that they can assess treatment?
Financial.
Yes, actually, our main, our main thing is to make sure these people have SHA. Because when you have SHA, at least 70% of your problems are taken care of. Then food. These people have no food. These people, most
Basic
of them,
needs.
Yes, are abandoned by family. They are sleeping outside. They are sick. They are not unseen, vulnerable, hopeless, in excruciating pain. So literally, and also another thing is because when my breast was removed, it shook me to death. I was like, okay, wait a minute. How do I move without
acceptance?
So acceptance. So we also give women breast prosthesis, mastectomy bras, and these compressors and other things to just make their life decent and feel normal again.
You'll talk to us about the compressors, but Dr. still on the finances. Nana is doing something with needy cancer survivors and
health initiative. Yes.
With the needy. I'm saying with the needy. I like the name needy.
Yeah.
And so this comes with the needy cancer survivors, needy people who need financial support, emotional support. Yeah. But Daktari, how is it with you treating patients? What are some of the greatest financial needs that you've seen in your patients?
So yes, now that's why I always say I think we need financial navigation programs, even like yesterday.
Yes.
And what I mean by that is there are a lot of patients, yes, there's the direct costs that are associated with cancer treatments, you know. This is tests that a patient, cost rather, that a patient would pay for, say, chemotherapy, radiotherapy, or surgical treatment. But these are still, you can still pay for them. Say what Nana said about SHA is very true.
Yes.
With SHA or previously in HIF, you can access almost up to 60 to 70% of the treatment. However, of course, the 30% you have to top up, which also significantly would delay costs because, like I said, some of the women would have no money at all. And they would, maybe the family would pitch in and buy or sell a plot or an animal to pay for that cost.
Yes.
However, eventually they can top up, but because this translates to poor treatment outcomes, and sometimes women would abandon treatment altogether. But these are not even our big problems, you know. It's the indirect costs that are more, we tend to not think about it, say the cost of transportation. So a woman's, if I just take an example, we have major referral hospitals or county referral hospitals where patients come for these treatments because, of course, we can't have radiotherapy machines in sub-county hospitals. Maybe if I'm to take an example, perhaps a patient is staying in Busia and she has to travel all the way to Moi Teaching and Referral Hospital. There's the cost of transportation that she has to pay to come to Moi Teaching, yes, or Nairobi. Yes. And then that cost equally, and she has to either date daily or it's not feasible to pay that daily, or even the transportation will wear off. Then she has to look for accommodation near the house, near the hospital, which again needs money.
Yes.
And then food, there's of course the caretaker who's there with her. So there's no food security, you know. We think, yes, to some of us this may seem something little, but there are a lot of people who would not have food. Again, what Nana mentioned again, they would have to queue up, and where to afford maybe a hostel or a facility to stay by may be very difficult, you know. So this end up staying outside the hospital for maybe 1 day or 2 days, or if they're not seen because of the long queues, maybe 3 days, then the cost of even something like wigs, even that, I know we tend to ignore this, but there's a whole cancer rehabilitation. Like Nana said, there's a lot of stigma. So someone may not want their family members or people to know that they're going through treatments, and then maybe they want to get something like wigs to that. So even that cost. So we never factor in that cost. And those are the main costs that actually make our women abandon the treatments altogether. So this is quite real. And I see it every day. And that is why you would see women coming with stage 4 cancers.
When it comes to nutrition, what are the do's and don'ts of a cancer patient?
Basically, when it comes to nutrition, we advise patients to eat a healthy, balanced diet, which basically incorporates taking loads of fruits and vegetables. Instead of the red meats, we advise them to switch on to white meat, particularly some of these cancers, or can I say some of these products, processed meat, red meat, usually is associated with certain cancers. So we would want patients to switch more to white meats like fish or chicken. Additionally, in terms of, just like I said, just about a healthy, balanced diet, so a small portion of carbohydrates, you have your proteins and you have your vegetables. We do advise women to also cut down on the alcohol intake. So those are some of the things that we would want them to take into consideration.
Okay. Yeah. I'd like to point one of the side effects of radiotherapy, which could be constipation. Huh? And yogurt helps with constipation, Nana, right?
Yeah.
What do you take, or what would you advise patients with cancer who are just from radiotherapy to take to prevent constipation?
Actually, I'll talk from my personal experience, especially during chemotherapy and radiotherapy. I had a lot of bloating, constipation, and my diet was more on probiotic foods. But you see, the natural.
Probiotic yogurt.
Probiotic yogurt.
We also have natural yogurt. Yes. So how did it help you, or how does it help you?
But you see the probiotic natural yogurt, specifically this one from Brookside, it's very good for the gut healing.
And you can have it. You can have it.
So this one is really, really, really good for. And the good thing is that this one is it's now affordable.
Yes.
Really, yes, it's affordable as compared to other brands where you have to charge quite a lot of money.
Okay.
So probiotic foods. Also, as Dr. Free said, you also need to do vegetables.
Yes.
But fruits, you have to be selective. And also the meats.
Yes.
And all carbohydrates.
But for probiotics, we have yogurt, but we also have other probiotic foods that you can take to help with that digestion in your gut. What are those foods, some of the foods?
Some of the other probiotic foods include kefir, simos, like me, I come from Meru. So the grinded Meru porridge is also very good for cancer patients. Yeah. The fruit, the citric fruits are also extremely good. Cabbage, raffinges, like the boiled maize, it's really helps. And also ripe bananas are extremely good for the digestion. Yes.
Okay.
All these foods.
All right.
Yeah.
All right. Thank you so much, Nana and Dr. Ari, for joining us. That's a lot of information. I wish we had more time to discuss this, but I believe we've gotten the basics. Good nutrition is important. Financial capability, register for SHA. Register for SHA so that even if you have to top up, ukiuliza watu wachange, they'll see that you've made some effort. So register for SHA, and then also get in touch with organizations like Nana's, the Needy Cancer Health Initiative, so that you can be able to work with them through your journey. And of course, the support system is very important. And as Daktari has said, and Nana has also said, it is very important to go for screening. Early screening saves lives. The earlier, the better. Thank you so much for tuning in. My name is Chebet Birir. See you again next week.
Health and Wellness brought to you by Brookside.
Brookside Plus, a fiber-fortified whole milk, will provide you with the essential fiber that you require in your body. For this reason, therefore, pregnant women, children who are not able to meet their daily requirements for fiber intake, or even people who are suffering chronic constipation would be able to use this product to provide bulk in their food.